Okay, let's just get right into it. If you're here, my guess is you're in a really tough spot. Maybe you're trying to have your mom or your dad make this incredibly complex, pretty urgent, and really expensive medical decision about their eyesight. And you're probably feeling, well, completely overwhelmed. The good news is you've come to the right place. Think of this explainer as your calm, clear battle plan. Yeah, I can't tell if that's the sidewalk or a shadow. That's what this is all about, right? These are the actual words from a mom whose world had gotten so foggy that just stepping off a curb became dangerous. This hits home because it's not some abstract medical thing. It's about safety. It's about confidence. It's about being able to just live your life. And this is the moment the panic sets in. You're in the clinic, the surgeon has just explained everything, and then a nurse comes over with this glossy brochure. It's filled with all these options, right? Monofocal, multifocal, toric, and the price tags? Whoa, we're talking thousands of dollars. And the worst part? You've got what, maybe 15 minutes to make a decision that's going to affect your parents' vision for the rest of their life? The pressure is it's insane. Okay, so let's just dismantle that pressure right now. Our whole goal here is to take that moment of pure confusion and flip it into total confidence. Seriously, by the time we're done, you're going to know exactly what the options mean, what questions to ask, and what you're actually paying for. All right, let's get into the core of it. We're going to demystify these options. Let's cut through all that confusing marketing jargon and just talk about what these lenses actually do in real life. 3 lenses, 3 basic paths you can go down. Okay, so first things first, let's make sure we're all on the same page. What even is this thing we're choosing? It's called an intraocular lens, or IOL for short. Basically, during cataract surgery, the doctor takes out the old, cloudy natural lens and pops this tiny, clear, artificial one in its place. So the big decision isn't if they get a new lens, it's which type of new lens is the right one. I love this analogy. It makes things so much clearer. So your first big choice is between these two. The monofocal lens, think of it like a super reliable sedan. It does one thing and it does it perfectly. It gives you really sharp vision at one distance, usually far away, which is great for driving. The downside? You'll almost certainly still need reading glasses. But the big plus is you get fewer weird visual side effects. Then you've got the multifocal. This is like the fancy convenience upgrade. It's designed to give you focus at multiple distances, meaning you might be able to ditch those reading glasses. But, and this is a big but, the trade-off is a higher chance of seeing annoying halos and glare, especially when you're driving at night. Now listen up, because this is super important and it's where a lot of people get tripped up. The toric lens. It's not a third option like choosing between a sedan and an SUV. Think of it as a critical add-on. It's specifically for people who have astigmatism, where the cornea is shaped a bit more like a football than a perfectly round basketball. A regular lens can't fix that, so the vision will still be blurry. The toric lens corrects for that specific shape. And you can add this toric feature to either a monofocal or a multifocal lens. Honestly, for a lot of folks, figuring this out is the real game changer. Okay, let's talk about the elephant in the room, the thing that causes the most stress, the price tag. You're probably sitting there wondering, how can something my mom needs to see come with a bill that looks like we're buying a car? It's a fair question. So let's break down what insurance actually covers, and more importantly, what it doesn't. And yeah, that's the number that just makes your heart stop, isn't it? An extra $4,000, sometimes more. And that's per eye. It's a really staggering figure to see on a piece of paper when you've got 5 minutes to decide. So, where in the world does that number even come from? Okay, this is the absolute key to understanding the cost. The question you need to ask isn't, is the surgery covered? Because, yes, the basic surgery is. The real question is, what part of this is considered a luxury upgrade? See, Medicare and insurance will cover the standard, medically necessary procedure with a basic monofocal lens. But all those huge extra costs? That's you paying out of pocket for the premium features, the toric correction for astigmatism, or the multifocal tech that helps you ditch your glasses. So let's put some ballpark numbers on this so it's not so abstract. With a standard monofocal lens, you're usually just paying your regular deductible or coinsurance, so the extra cost is often zero. If you need that toric upgrade to fix astigmatism, you're looking at adding somewhere between, say, $900 and $1,500. And if you go for the multifocal upgrade to reduce the need for glasses, that's where you see the big jump, maybe $2,000 to $3,500 extra.
Again, these are just estimates, but it gives you a much clearer picture of the financial landscape. Okay, so now you get the lenses and you get the costs. Knowledge is power, right? But now let's turn that knowledge into a real plan of action. This next part is all about arming you with the tools you need to walk into that surgeon's office, not as a passive, confused family member, but as an active, empowered advocate. And you can start right now, before you even go to the appointment, with this super simple checklist. Just think about these 5 things. 1. Astigmatism. Does your parent have it? If so, the toric lens has to be on the table. 2. Retina health. Any other issues like with the macula? That might rule out a multifocal. 3. Night driving. Do headlights and glare drive them crazy? That's a big point for the monofocal. 4. How much do they hate reading glasses? Be honest. And 5. Budget. What's the real number you're comfortable with? Just thinking through these narrows your options down big time.
All right, now for your secret weapon. You don't need to be a doctor. You just need to have the right questions ready to go. We're going to give you 4, just 4, incredibly powerful questions that will completely change the dynamic of that conversation. Okay, question number 1. If this were your eye at 74, which lens would you choose and why? This question is pure gold. It immediately cuts through any kind of salesy vibe and forces them to give you their personal expert recommendation. It changes the conversation from a list of products to a human-to-human consultation. And that why at the end, that's where you'll get the real insight. Next up, how much astigmatism do I have, and what happens if we don't correct it with a toric lens? This question pins them down for a specific answer. It's not just about a number, it's about the consequence. What will their vision actually be like if you skip this upgrade? Is it a minor inconvenience, or is it like having a permanent smudge on your glasses? This is how you figure out if that toric lens is a nice-to-have or an absolute must-have. I love this one because it's so smart. What problems make you hesitate to recommend multifocal lenses in patients like me? This is how you get past the brochure's sunny promises. You're not just asking about generic risks. You're asking the surgeon to tell you what they worry about for a patient with your parent's specific profile. It's how you uncover the real-world trade-offs, like the halos and glare, that might not be in the big print. And last but not least, the money question. You just ask, can you show me an itemized quote that separates the covered services from the upgrades? This is the exact phrase you need. It politely but firmly demands total financial transparency. You want to see, line by line, what's medically necessary and covered versus what's an elective upgrade that you're paying for. No hidden fees, no confusion. All right, so you've done the research, you've asked the questions. How does this all actually shake out in the real world? Because the theory is one thing, but what you learn from actually going through it, well, that's where the most important lessons are. And here are some of the most surprising, hard-won lessons. First, covered by insurance definitely doesn't mean free. You've still got deductibles. Second, do not look down on the basic lens. For so many people, it's an absolute life-changing miracle. Third, as we said, astigmatism is the secret boss here. It often dictates the whole game. And maybe most importantly, you can do one eye, see how it goes, and then decide on the second eye. You don't have to commit to everything at once. So after all of this, the stress, the research, the cost, what does victory actually look like? What are you fighting for? I can tell you this, it has nothing to do with getting the most expensive, top-of-the-line lens. The real win, it's something much, much more meaningful. This is the victory. I can see individual leaves again. That's what the mom in this story said the day after her surgery, just standing at her window, looking at a tree, something she hadn't been able to do for years. The world snapped back into high definition. That's what you're working towards. And you have to realize what that means. For years, without even knowing it, she'd been living in a soft focus, blurry version of her own life. It just faded away slowly. So this wasn't just eye surgery. It was a reset. A total reset on her ability to connect with the world, with her grandkids, with everything. So as you head into this journey, just remember that. This isn't just a clinical choice about a piece of plastic. You're helping someone you love press the reset button on their entire life. How amazing is that? So the only question left is, how will you prepare to press it?